As a professional, you should only treat scalp conditions specific to your salon's provision, or you should refer your client to a registered professional. Trichologists specialise in hair and scalp conditions and can diagnose and treat these conditions. A general practitioner, GP, has a general medical training and has access to NHS services. They can prescribe drugs and refer patients to specialist consultants. You must keep a record of clients' treatments used, to keep a record of any contraindications, for retail references for salon and promotions, for insurance purposes, as a record for any legal action. It is essential to carry out a thorough consultation to establish contraindications, which may prevent treatments such as infectious or contagious conditions, open cuts, recent scarring, abrasions, and medical conditions requiring specialist or general practitioner approval. Restricted contraindications such as epilepsy, diabetes, high and low blood pressure, pregnancy, product allergies, and skin sensitivity. So a stylist has records of previous treatments and services undertaken, to assess the client's preference and progress, carry out the necessary tests. Some contraindications will mean that you cannot proceed with the treatment.
Please refer to the unit, provide consultation services for detailed tutorials on testing.
Any infectious or contagious skin conditions or diseases will have a risk of cross-infection. If a client is receiving chemotherapy or radiotherapy treatment for cancer, treatment must be under medical supervision and advice should be sought. This is because of the toxic effects of the chemotherapy on the body and the possible tissue damage on site of radiotherapy. Both these treatments increase the risk of adverse contractions. If the client has a high temperature or fever, there is a risk of possible cross-infection. The client is also fighting an infection, so massage may compromise the body's healing. If a client has a migraine or a severe headache, then stimulation and increase in circulation may increase the symptoms. If a client has arthritis or rheumatism of the neck, there is a risk of making symptoms worse. Cuts and abrasions or recent scarring can restrict or prevent treatment being carried out. Contraindications that may restrict or limit a treatment are epilepsy, diabetes, high or low blood pressure, recent scar tissue swelling, product allergies, medication, skin diseases, eczema or psoriasis, open wounds, cuts and abrasions, severe bruising, sunburn, pregnancy, skin sensitivity, metal braces and jewellery in the area. A thorough consultation must take place in order to ascertain the correct information and to apply the correct treatment. Use observation, questions, record, and differential diagnosis. This is where you look for signs, associated signs, and symptoms, and use this to eliminate potential conditions. For example, does it look scaly? If it does, it could be a number of conditions. Look to see if there are any other signs elsewhere on the body. Through a process of elimination, you can identify the condition. Scalp treatments can be sensitive in nature. Ensure your client feels comfortable in the consultation and service process. Where possible, act to relieve stress, embarrassment, create an environment of trust to facilitate discussion, maintain confidentiality, and encourage questions. Make sure the consultation takes place in private. All these factors will promote a professional attitude and will encourage clients to return. Be respectful of the client's cultural and religious traditions and beliefs. Be mindful of your client's expectations during the consultancy process. They may require a cure, require a quick remedy, want to know cost and service time, want to be reassured, want to know if the condition will need ongoing or further treatment, or if it will return. It's important to be realistic to avoid client disappointment and damage to salon reputation, and to provide encouragement as the treatment acts in its expected timeframe. Be aware of other supporting treatments, GPs, complementary therapies, alternative therapies, herbalists, trichologists, Chinese medicines, counselling, and wig specialists. If a client arrives wearing a postiche, a wig, be extra sensitive. They will invariably be expected to remove it for a proper consultation. A change in appearance can have a negative effect on a client, leading to low self-esteem, uncomfortable social situations, and sometimes a breakdown in their relationship. It is essential to identify factors that may limit the service and products that may be used on a client. This is to ensure suitable treatment, product, tools, and equipment are used. Ensure you obtain a signature from your client. This demonstrates consent and is a record for any legal actions. To assist in clarification and confirmation of the service, check your client understands the service and what it will do. Do not give unrealistic expectations. These are some of the conditions that you'll be looking for. Ringworm, tinea capitis. It's caused by a fungal infection, often found in children. It is highly contagious and the client needs to be referred to their GP. Most likely affected in the occipital, temporal and nuchal areas of the scalp. It takes form of circular patches, usually red with dry grey silver scales. Hair loss can occur and hair is often brittle and broken in the affected areas. There may be a secondary infection where the areas have been itched. Impetigo, caused by bacterial infection. It is highly contagious and your client needs to be referred to the GP. Yellow pus-filled crustaceans or pustules, which are prone to weep, commonly surrounded by erythema. Scabies, the itch mite, is highly contagious and the client needs to be referred to their GP. The itch mite, Sarcoptes scabies, buries under the skin and this causes an allergic reaction that is very itchy. On the skin surface there will be silvery lines, little red blotches and commonly redness and signs of scratching. Traction alopecia, caused by excessive or extensive tension on the hair follicle. This is commonly due to wearing your hair tied too tightly, hair extensions and weaves. It is often seen on afro hair where weaves and braids are popular. The places it is usually most apparent is around the hairline where hair is naturally finer. The client needs to stop applying tension to the affected areas and should be referred to a trichologist. In salon, scalp massages may help stimulate hair growth, but tension should be used to a minimum. This could be either a temporary or a permanent loss. Folliculitis, caused by bacterial infection of the hair follicle. Hair follicles will be inflamed and pustules will be apparent. They will often be itchy, so secondary infections are common. If they are not treated, they may form raised scars known as keloids. Can be all over the scalp, but frequently around the occipital and nuchal area. Often found on curly hair that is shaved, as curly hair can spring back on itself to create ingrowing hairs, growing back inside the hair follicle. With this itching, bacteria often enters the hair follicle through the fingers. Dirty equipment such as razors can spread bacteria into the hair follicle and cause folliculitis. Chemical abrasions are often itched when highly sensitised. A thin application of antiseptic cream may be used to soothe the area. Clients should be recommended to the GP for antibiotics and a trichologist for further treatment. Pityriasis capitis, Pityriasis simplex, or commonly known dandruff, is a mild form of seborrheic eczema, caused by dry scalp, chemical irritant, or overproduction of skin cells. It appears as white or grey loose scales. It seldom itches, and there should be no sign of erythema. Shampoos containing zinc pyridoxine and selenium sulfide can help control it. Ingrowing hair caused by continuous close cutting of the hair on the skin is called prefolliculitis. Radiculitis capitis, head lice, is an infestation caused by contact with an infested person. It is very common in children or people who come into close contact with children. Head lice are tiny wingless creatures with 6 legs. They cause itching due to the anticoagulant that they inject into the blood. Head lice lay eggs known as nits. On first appearance, nits can look like dandruff. They cement themselves to the hair shaft, so when the hair is combed, they remain attached to the hair shaft, as opposed to dandruff that is just combed off. It's important to examine the hair thoroughly, as eggs can be missed. There are many types of hair loss. Androgenetic hair loss in women, female pattern baldness. Diffuse thinning throughout the top of the head, never the back and sides. Normally occurs when hormone changes, such as puberty, pregnancy or menopause. The stages of female hair loss are known as the Ludwig scale. Stage 1, diffuse thinning on the top of the head. Stage 2, spreading of diffuse hair loss. Hair becomes very sparse. Stage 3, noticeable loss of hair on frontal area, not inclusive of the hairline. Androgenetic hair loss in men, also known as male pattern baldness. Androgenetic hair loss in men begins at the bilateral recession area, to the temples or around the crown area. It usually results in the gradual thinning of the hair throughout the top of the head. No hair is seldom lost around the mastoid or occipital bone. It is hereditary and commonly passed down from the maternal grandfather. People need to know the basic theory of the hair cycles, anagen, castogen and telogen, to understand the theory behind male pattern baldness. Post-puberty, when there is an increased level of the hormone testosterone. When the testosterone reaches the hair follicle, the enzyme 5A reductase turns the testosterone into the hormone called dihydrotestosterone. On men who are genetically inclined to hair loss, the dihydrotestosterone results in hair becoming shorter and finer during every anagen cycle, making the hair finer until eventual hair loss. There is no cure, but lots of treatments on the market: minoxidil, finasteride, hair transplants, cosmetic enhancers. The male pattern scaling system is known as Hamilton or Norwood scale. It goes from 1 to 3, as with female loss, as well as gradual receding from the temples. 3 to 4, circular patch of hair loss on the crown. 5 to 6, crown area and receding hairline meet. 7, the hair loss moves toward and over the parietal ridge. Examples of diffuse hair loss are telogen effluvium. This is the most common form of diffuse hair loss. It's excessive shedding of hair, usually over 100 hairs a day. Hair suddenly begins to feel finer and the shedding feels sudden. This appears all over the scalp. Shorter hairs may be seen regrowing on the scalp. The ends of these hairs will be tapered. The telogen phase of the growth cycle is shortened. This can be for a number of reasons, such as insufficient food, stress, bereavement, drugs, blood loss or fever. Hair should return to the natural growing cycle if these factors are eliminated. There is no treatment, but you could get a patient to go to the doctors to test their serum ferritin levels or refer them to a trichologist. Postpartum telogen effluvium is hair loss after having a baby. Anagen effluvium, which is sudden and drastic hair loss, is commonly the result of chemotherapy. Diffuse traumatic loss, for example, would be pulling grey hairs out fanatically. This can cause permanent hair loss. Alopecia areata is an autoimmune condition, and this can occur in short term or long term. There will be patches of baldness on the scalp, but under close inspection you'll see fine hair follicles in these patches. They often look like vellus hair. Around the periphery of the areata patches, there may be short examination hairs that indicate that the patch may extend. Refer to a trichologist. Alopecia totalis is where there is no hair on the head. Alopecia universalis is where there's no hair on any area of the body. If hair follicles are not apparent in the areas of diffuse hair loss, the client should visit a trichologist or a GP to identify if this is a scarring condition that may be permanent. Other signs and symptoms can indicate the cause of the problem and confirm the required course of action. For example, pitted nails, alopecia areata, weight loss, telogen effluvium, and lethargy, lack of iron, could also be related to telogen effluvium. These are likely causes of various adverse hair and scalp conditions. Be mindful of all the factors involved in the consultancy process to avoid misunderstandings, client dissatisfaction, complaints and legal action. Always focus on providing treatments to meet the needs of the clients. Dry scalp, matte-looking cracks on the skin, fine lines, lack of moisture, itchy. Oily scalp, shiny, wet-looking, may have an odour. Sensitised scalp, inflamed, may look sore, may be painful, swollen and itchy. Scaling scalp, loose flakes of skin, looks rough, dull. Pityriasis capitis, flakes on the scalps, some loose flakes that may be yellowy, moist, they may have an odour. Physical damage, breakage along the hair shaft, may be all over the head or in a particular area. Split ends, broken hair on shoulders when brushed. Environmental damage, usually UV damage, wind damage, or even damage from pollutants. This may make the area lighter around the front hairline, lighter ends, darker roots, and almost a bleached out effect, but no apparent artificial colours being used. Ensure client's position for comfort, professionalism, to prevent injury, ease of application, and reduce fatigue. Ensure your body position, your tools and equipment are in the correct place for the ease of your use.